Most rehab physicians do not lose money because they lack clinical skill. They lose money because they hesitate. They hesitate when asking for fair medical director compensation. They hesitate when negotiating call coverage. They hesitate when hospitals increase workload but decrease reimbursements. They hesitate when administrators frame collaboration as do more work for the same money. And while they hesitate, someone else decides their value, and that's the dangerous part. Physiatry is facing a brutal reality. Demand is increasing, patient complexity is rising, reimbursement pressure is tightening, and the physician workforce is not expanding fast enough to meet the need. The opportunity is massive, but so is the risk. The physiatrists who know how to communicate their value will build profitable practices. The ones who do not will become highly trained employees inside businesses they did not design. That should bother you, because communication is not a personality trait, it is a business asset. But most physicians picture confident communicators as loud, charismatic, fast-talking extroverts who naturally command the room. That belief is convenient, but it is false. Confident communication is not about being the most dominant person at the table. It is about saying what you mean without apologizing for having value. In business, that difference is everything. The first habit of confident physician entrepreneurs is that they stop weakening their own message. They do not say, "I'm sorry, but I was wondering if maybe we could revisit compensation." They say, "Given the scope of responsibility, patient volume, liability exposure, and operational impact, this compensation structure needs to be adjusted." Same physician, same facts, different packaging. And packaging determines whether your message lands as a request or a leadership position. The second habit is silence. This is where many physiatrists lose the room. They make a strong point, then panic in the pause, so they keep talking, they over-explain, they soften, they add disclaimers. They turn a clear business position into verbal mashed potatoes. Confident communicators state the point, then stop. Silence is not awkward, silence is leverage. If you want to build a profitable physiatry practice, you must become comfortable letting your values sit in the room without rescuing everyone from the discomfort of hearing it. The third habit is holding position without escalating. When an administrator says, "That rate is outside our budget," the inexperienced physician hears rejection. The confident physician hears information. There is a difference. A confident physician does not retreat. They do not become defensive. They simply restate the value. "I understand budget matters." The issue is that the proposed structure does not match the clinical responsibility, operational impact, or market demand for PM&R leadership. That is not arrogance, that is alignment. Hospitals need physiatrists who can improve throughput, reduce length of stay, support functional outcomes, strengthen post-acute transitions, and protect revenue integrity. But if you cannot clearly communicate that value, the market will gladly underpay you for it. The fourth habit is speaking in real time. Too many physicians communicate with a delay. They edit every sentence before it leaves their mouth. They worry about being perceived as difficult, greedy, aggressive, or not a team player. Meanwhile, the business people in the room are negotiating. Medicine taught physicians to be helpful. Business rewards physicians who are helpful and clear. That is the healing, hopeful, helping truth. You do not need to become a different person to become a confident business owner. You need better communication habits. Use fewer words, make direct requests, stop stacking apologies, do not abandon your position at the first sign of disagreement, let the pause do its job, because the future of physiatry will not belong only to the best clinicians. It will belong to the best clinicians who can explain their value, defend their economics, and build systems that serve patients without sacrificing the physician. This is where I helps physiatrists reclaim ownership, not with empty motivation, not with boss babe medicine in a white coat, with practical business education, clear positioning, and the language physicians need to negotiate, lead, and build profitable practices. The fear is real. More work, fewer doctors, lower reimbursement, and growing administrative pressure, but so is the opportunity. The physiatrists who learn to communicate like owners will not just survive the future of medicine, they will help build it. So here's the question every physiatrist should ask before the next meeting, contract, partnership, or negotiation. Are you communicating like an employee asking for permission or like an owner building the future?